guys, this is Nurse Practitioner Brittany Jackson at Jackson Health and Wellness Clinic, coming to you today to show you how to appropriately draw from a vial. We have a lot of patients now that are on our monthly subscriptions of Semaglutide. If you're interested in doing that, you need to watch the last couple videos, and that'll tell you all about our Semaglutide membership plans, what it is, how much it costs, and how you can get involved. So these medications are shipped directly to your house. You get the vials, syringes, alcohol pads, everything you need to do the injections. But if you've never done an injection before, you may be confused. We will teach you how to do them in the office, but sometimes it's nice to have something to refer to in case you forget. I forget things from time to time too. So the things that you're going to need are you're going to need your vial. I'm using an old Botox vial. It's not Botox, it's water, sorry. You are going to need a syringe, and you will need an alcohol prep pad. All of that should have came directly to you. So the first thing we're going to do is open our alcohol pad, and we are going to clean off the top of our vial. Now, why do we do that? Once this vial has been opened, it has been exposed to air and germs. So there could be germs on top of the vial that we don't want to get in the vial because what is inside the vial is considered sterile. So we wipe the top of our vial off with our alcohol pad. We get our needles. So you want to uncap your needle. These are insulin syringes, so they're teeny tiny little needles. And the one that I have goes up to 50 units. There are a variety of different ones. Some are 30, 50, 100 units. But for our purposes, we are going to draw 25 units. So you can see it labeled right there. So I'm going to hold my vial up. We're going to hold the needle perpendicular and go straight in to the center of the vial where that little circle is. We go straight into the vial. You're going to invert it, which means to turn it upside down, all while this stays together. So keep your needle pushed in and invert. So that brings the liquid down to where the needle is. You need to learn how to hold the vial with your index finger, middle finger, and thumb, and use these two fingers to stabilize the syringe. So you're holding all of this in one hand so you can use this hand to pull back. So I'm going to very slowly and gently pull back on the needle plunger until I get 25 units. Now, if there is any air in your syringe that you need to get rid of, very gently kind of tap it with your finger. Don't hit it really hard because you're going to bend your needle doing that. Sometimes you need to pull back a little bit more and then push back up to the 25. But once you get to the 25 units that you need, you're just going to take the vial and pull straight back off. And your syringe is ready to go. You can either lay it on the alcohol pad, you can recap it. Now, most of the time we don't recap needles. However, this needle has not been in anyone, so there's no risk of contamination. And putting it right back in the cap that it came with is a safe way to hold it until I'm ready to inject it. So when you're giving these injections, they are sub-Q injections, meaning they need to stay in the fatty tissue. So most people do them in the abdomen, needs to stay 2 inches away from the belly button, rotate sites. If you're having someone else do it, they can do it in this back part of your arm here. Or you can give it in the leg. You just need to be sure that you're staying in the sub-Q tissue and you're not getting into the muscle tissue. This medication is meant to work in the sub-Q. If you get it into the muscle, it won't be as effective, okay? So you've picked your spot. This is my spot. You're going to take your alcohol pad and you're going to clean off the spot that you're going to inject. We are going to uncap our needle here. And you're going to want, if you're doing this on yourself, you're going to kind of pinch up a little bit of skin in between your fingers. And when you do this, it needs to go straight in. You don't tilt it at any angle because of how small these needles are. It goes directly into the skin. So, and also as you're pushing this in, don't have your finger on the plunger because you could accidentally push the medication in before the needle is all the way in. So you're going to push it straight in. If you have 2 hands and can do it, you can stabilize the needle with this hand, or you can just move your finger back and push all of the medication in at a slow, steady rate. Once you get there, wait about a second or two to make sure all the medicine came out, and then pull straight back out. And then this is ready to be disposed of in a proper sharps container. Typically, we do not recommend recapping now because this has actually been inside someone, so it could have some blood and stuff on it, so we don't want to do that, okay? So then you toss it in the sharps. That is how you appropriately give a sub-Q injection. Typically after injections, shouldn't bruise, shouldn't bleed, can happen on occasion, but it's rare. May have a little redness or irritation at the injection site, which is why we recommend rotating sites. If you have any questions or you would like to get involved in our Semaglutide membership program, you can reach us at 270-629-6722. We are on Facebook, Instagram, and TikTok. You can also check our website at jacksonhealthandwellness.com. Thanks, and we hope you have a great day.